see children between the ages of about 9 and 16 who have a problem with heel pain in the heel part of their foot. This is called a Sever's disease or Sever's condition. And in fact, what happens is people think that it's where the Achilles tendon attaches into the bottom bone, the calcaneus. It's not the insertion, it's actually a small irritation of the growth plate. In children with growing bones, they have growth plates and they tend to get an irritation at the growth plate, at the place of growth, when they're quite young with an increase in activity. Now, a lot of these children do not have reduced things like calf length. So if we measure their calf lengths, looking at how tight their calves are, the vast majority don't have tight calves. So if we look at me in this position, that's a tight calf or I can't stretch forward. Rarely do they have a reduction in calf length. They usually have a reduction in strength, and usually it's due to overuse. So traditionally in our clinic, I'll review patients who have failed physiotherapy or conservative treatments in other clinics or with other practitioners, and they've concentrated too much on static stretching, and static stretching is not a problem. Secondly, they've probably done not enough of the strengthening to make it stronger to stop this problem around the calves and around the hips. But the most important thing with this group is resting them. And we tend to see that these are overuse injuries almost every single time. Too much sport too quickly, too much of the same sport, too much jumping and landing. And we need to actually give them a rest from these activities. My experience over many years is that the best way of doing this is not to send them straight onto a strengthening program, but in fact, often we can put them into one of these snow boots, and we put the child into a boot like this, get them to wear it pretty much continuously for 3 or 4 weeks. All it does is settles the inflammation down. It stops them running. How can you tell a 10-year-old not to run? It's almost impossible. It's too extreme to put them in a cast, a fiberglass cast, but putting them into a boot like this, which we have some, we can loan you, and doing that for 2 or 3 weeks or until it settles and it stops them playing in the playground at lunchtime. This is a very simple approach and it's very successful. Once the irritation and the growth plate is settled, then we can start them on a strengthening program. And for a parent, it's so much easier because we can actually, we can rest them by keeping the boot on all of the time except when they're sleeping or showering. And once the tenderness is settled, there's no pain on calf raise or touching it, then we can do the strengthening program. And I have to say, my experience over the years pretty much points to one thing. We need to actually rest it initially. And resting it with a youngster is really tough, but using something like a boot that we can supply really gives them, gives you an advantage in allowing the inflammation to settle, and then we can do the strengthening program. Traditionally, Osgood Schlatters can take, unfortunately, probably anywhere between 6 and 12 weeks to settle. But think again in using something like this. It seems like you're taking a step backwards, but it's proven to be very successful.